questions about the Halogen or the eribulin. My oncologist has mentioned it, that may be my next thing. And someone, Jan actually said to me that 2.5 months. But that's a statistic.
Yes, that's an average.
So that doesn't really mean that that's, if I go on it, I'm only going to get 2.5 months.
So the average time it works in comparison to any other chemo is 2.5 months more than any other chemo.
Okay.
What you've got to realize is the wonder drugs, even though I'd love to have wonder drugs and be able to offer a drug that I would give it to patients, couple of courses, and their cancer goes away for years and years. But the reality is cancer is very complicated. It's not that straightforward. All these treatments, so people might say, why you do this treatment? It only adds 3 months extra and it costs so much to the society. But what I say is if I don't treat the patient at all, and this drug gives patient this many months, and this drug gives this many months, and this drug gives this many months, and this, and this, and this, and this, look what is the difference.
Well,
and it is what we call sequential building.
I've had secondary breast cancer since 2003, and I've been constantly on chemo for the last over 4 years.
Off and on?
No, only one off, early in the stage, but constantly. I never get a break. So I have had times where it's sort of built up and you made me feel really sick, and I'm just coming out of that now. But given that I've been on all these different drugs and now possibly going to go on to another one, my latest scans about 6 weeks ago showed that none of my, like my liver and everything hadn't grown since February. But now I've got a tumour in my shoulder, which I'm having radium at the moment. So it obviously hasn't been doing anything with the cancer in the bones.
Yes and no.
Yes and no.
So, like I explained to you, you may have a weed that grows in there and then it sheds seeds in different areas. This seeds near your neighbor's backyard grows much faster than this seed in your own backyard. So over time, the cancer can mutate and change. And there are actually studies, not in specifically breast cancer, but in kidney cancer, where they've taken one kidney cancer from 11 different parts of the kidney, biopsied it, and found that they are all slightly different to each other. So what it means is in general, when we give patients chemotherapy, and it's not just with breast cancer, any cancer, the response is uniform. Sometimes we see a non-uniform or a mixed response. Some cancer is same, the other gets worse, and even more challenging is some cancer shrinks and another one gets worse. I recently treated a patient with melanoma. So his cancer in the, he had lymph nodes in the axilla, he had huge amount of cancer. His cancer in the axilla and in the chest wall and in the lungs all shrank. Disease in the liver shrank, but then he went brain mets. So these sort of things we see. So mixed response is seen, and then depending on unique situation of the patient, sometimes we might say there is only one little spot, let's just target that spot if it is on the bone. The good thing about bones is it doesn't perform a lot of function in our body other than provide a framework, and parts of bone form a bone marrow. So you can give high dosages of radiation to bone with good effect. So sometimes I have gone through that if it's only a 1 or 2 spot, give radiation and keep the same chemo going. It's sort of like you have limited cards. So you're trying to get most out of each card. You have to sequence them around well and play your cards well to get your patients the longest amount of time and the best quality of
So
time.
at my age, that it would be going against me really. I'm 71.
No, that your age is a couple of things.
It's young.
It's young. It's
Not around here, it's not.
well, it's all relative because it's not just your age. So one is what is your chronological age. Second is what is your biological age. Thirdly, how many medical problems you have. I mean, I treated a young lady and I'm still treating her with secondary breast cancer. She's unfortunately got HER2 positive breast cancer. She was very fit. She was 45 when she got diagnosed with very aggressive 28 lymph nodes involved, positive early breast cancer, treated her with chemo. And she said to me, doctor, I feel tired on chemo. I gave her IC. Some of you might have had anthracycline and cyclophosphamide. And I said, what you can't do? She said, I only go for 5-kilometer jog. I used to go 12 kilometer every day. This is while she was having IC. So I said, I can't do 5-kilometer jog. So I don't know what are you talking about. So that answers in a way. It depends on, like, somebody might be 65, but biologically their body might be more like 80. So every treatment I give to them, I'm worried because they are having too many side effects. It also depends on your body's ability to handle things. Like, I give sometimes the same chemo to different patients. Some gets admitted every cycle with repeatedly with infection, febrile neutropenia in the hospital. Other never get admitted. I, in fact, at a time was treating 3 ladies with with early breast cancer, with IC chemo, all 3. I like IC, that's my preference, but that's different. The woman who was oldest never got admitted. The woman who was youngest got admitted every cycle. And she was the fittest. And she used to do 4 kilometers running every day. So just to give you an idea, it's not also just how fit you are, but also your body's enzyme and rest of your body's normal tissue, how it
That's what I wonder, how long can I hold up for this?
It's a physical and psychological pattern.
Yeah.
When you are fighting the breast cancer, your treatment and your doctor is one side, and your family and your psychologically support is on the other side. And there will be days, means these are difficult times. In fact, it's very interesting that a lady with secondary breast cancer, like you had in 2003, she's had it since 1999. I've been treating her now for the last 40
My primary was 1993.
Yeah. So she said to me, no, she has had secondary breast cancer since 1999, and she said to me, I developed survivor fatigue.
Yeah.
And that was 6 months ago, and I hadn't even heard that term before. And I said to that, what do you mean? She said, when I first got diagnosed, everybody told me, because in 1999 I had 12 months to live. Now I've been living for 15 years, and I don't know how to take each day. So there is another aspect, it rises completely, that all these treatments we can do to our patients make them live longer, but we also got to work on making them feel better and reasonable in that aspect. And I think the family and their interactions with their oncologist comes and plays a role in that regard.
And this group, Bridget, you wanted to ask a question.